One misconception that patients have with heart failure is the simple term that it's called heart failure, that it has failed. It's a misnomer. The same medications that we use to treat heart disease are used to treat heart failure, except in more robust amounts.
So we use medications in heart failure both to make symptoms better but also improve survival with heart failure. There are certain classes of medications that we routinely use. For example, angiotensin receptor blockers or ACE inhibitors are used to relax the blood vessels, to decrease blood pressure and increase the amount of blood that's getting pumped forward to the body. Beta blockers are another class of medications that we routinely use in heart failure patients.
In addition to those medications, we use what are called diuretics. These are medications that decrease the amount of fluid in your body.
We also use a class of medications very routinely called mineralocorticoid antagonists or aldosterone antagonists. Not only do they help with fluid retention, we know that they actually affect mortality.
There's a new medication now that is a combination of valsartan and sacubitril. Valsartan is a relative of an ACE inhibitor. Sacubitril is a brand new class of medications, and it's actually a hormone that's released by the top of your heart to help patients unload the pressures of their heart.
We recommend dietary modifications. For example, a lot of patients with heart failure are very sensitive to salt intake or fluid intake.
We recommend 1,500 milligrams of sodium or less per day. So you have to be very cognizant of what you're eating and really look at the labels, and you'll be quite surprised.
After you've been on a series of medications and we recheck to see if the pumping of the heart improved. If we notice that the muscle still remains weak, we may suggest that you need a device. This device is called a defibrillator. If your heart were to go into an abnormal rhythm, it would ultimately shock you out of it.
There are certain situations where, despite our best efforts with medical therapy and other device therapy like defibrillators, that patients still continue to get hospitalized with heart failure, and they find that their heart failure is really limiting their quality of life. In those situations, we generally tend to escalate care. For example, we start to evaluate patients for more aggressive therapies like a left ventricular assist device or, in certain situations, a heart transplant.
Heart failure can be heart success, and it can be a heart success if you really make it into a life event.